Hi, this is Dr. Antolak from thegentlendentist.com. We're actually getting ready to do a surgical procedure. Wisdom teeth. All kids need their wisdom teeth. Not all of them, but some do. And the reason why we're going to be removing wisdom teeth here is they're impacted. We'll come right over here to our x-ray, and these are our digital x-rays that we use. And so what I'll do is get it going here. Come on, there you go. And so we're going to notice that the wisdom teeth here are impacted quite far down. This is actually the nerve of the jaw here, so we want to get them before the wisdom teeth get down too far. So he's got two upper teeth that we're going to be doing today, and on the lower he's got two on the lower here, and they're angled in such a way that they're not going to come in. So we're going to be taking them out, and they'll be done surgically for that. Okay. And so I'm just going to show a few snippets as we do this. Usually when we do wisdom teeth, the upper ones are much easier. So let's start that way. We'll start with an easy one. Okay, and I'll need these guys opened up. And so actually, when we look here, we don't have any signs of the wisdom teeth at all. They're all buried right below the gum line here. So we're going to have to gain access to them when we do that. So okay, so let's go ahead and get started with the top one here. And so we just have to back out just a little bit. All right, and it's a little incision here. And he's numbed up, so he's not feeling anything. All right, and see the elevator? Periosteal elevator? Periosteal elevator? There you go. Okay. And so it's the gums really are almost like it's like peeling a banana. And so the gum tissue, the bone sits right underneath the banana peel. And in this situation on his right side, we're just going to unpeel that banana. Hand me an elevator now. Alright, and so what we're going to do here is, on the upper one, like I say, it's underneath the gum tissue, but we're basically going to put a lot of pressure here. And it should come right out as we take it out. There you go. You can see it come right out, just like that. Isn't that exciting? There you go. Let me just grab the back. I got it. Yep. Okay. There you go. There it is. There's your tooth. All right. That was easy. Trust me, they're not all going to be that easy. Especially out there. Okay. Let me see the curette. And so what we got to do is we just have to kind of clean it, and anytime in here you have what's called a follicle, which is a little sac of protection that starts to grow, and I'll need the sutures, and that follicle needs to be cleaned out. It's like a little developmental sac that we need to remove that so it doesn't create any problems. We got that. So we're going to just put a stitch in here briefly. And so wisdom teeth are sometimes people ask me, well, does everybody need to have wisdom teeth removed? And the answer to that question is really is multifaceted. There actually needs to when we do extract teeth, it's if there's no room in the mouth to come. And so so if there is no room, then usually we can do that. There'll be cases sometimes when young adults are there, and the question is okay, so what age is it that you have to make a determination of when wisdom teeth should be removed? Usually, and the answer to that question would be, it depends on their age. I mean, if once we get usually girls over, or young women over the age of, believe it or not, like 24 or 25, sometimes for elective procedures like that, it gets to be almost a little too old for those elective procedures. So it's best to really take care of them in their late teens and early 20s. Okay, cut those two. Late teens, early 20s is about the best age to take care of. On the lower one now, and this thing is buried below here, and it's encased in bone. So what we end up doing is, so I hope you guys can handle this, whoever is watching. But we basically will make an incision here, and with that incision, we'll then gain access to right where the bone is, which is sitting right down there. In addition to that, we need to
extend it out a bit more over here, and he's completely numbed up. So, and he of course knows to just raise his hand if he needs me to stop. So, and then we're just going to take that, and then once again, like we did on the other one, we're just going to kind of peel this off. Lots of push though, right? Lots of pressure. And very good. So about wisdom teeth, what are the reasons why we need to take wisdom teeth out? Well, one of the reasons why is, and we emphasize it at a young enough age, because, well, when you're younger, you certainly heal faster, but there's always a potential that part of that wisdom tooth will actually grow, and it'll penetrate out of the gum tissue, and when that does happen, then all the bacteria of the mouth can actually gain access to the tooth, and then you can develop cysts and infections and things like that. So while you're young, we get them out, and then that way you're not going to have problems with them in the future, you know. So here we've got the kind of the gum tissue folded back here, and that's actually bone right there. Bone and the tooth. Now that it was in there, now we can see that this tooth is actually starting to come out, and we put lots of pressure here. We created a little trough here for it to come in, and I actually had to kind of section the tooth a little bit. It's taken about, what, 15 minutes or so, 10 or 15 minutes elapsed time. But I didn't want to bore all of you during the process and listen to me talk, so we just would go ahead and do that. So anyway, we're almost have this out. Just to remove a little bit more of the bone back here. Just the angulation was quite significant. Okay, so basically when the tooth is out, it leaves quite a hole in here, and where that hole is that's going to end up filling up in bone. What happens, blood that's here, actually how we've been created, the blood will actually turn to bone over a healing process. So that's why when you have your teeth removed, it's not a problem. The bone usually will heal in there. Okay. It's out. It's taken about...
Start over. Sorry. Go ahead.
Okay, so we went ahead and took the last one out. We used this little block here to help his jaw. So we put some stitches in here. Where's the lower one is here. We got that one out. The top one's out. That one's out. And this one here down here is out. Okay? And so he's going to go ahead and do that. Now we have them also just spread out right here for you. So these are the 4 wisdom teeth. So anyhow, that's it. You're all done. I'm sure you're disappointed with that. Okay. And so, if you know, now is the time of the season. We have springtime here now in Michigan, and the trees are blooming, the flowers are budding, and whatever. And now we've got teeth that need to come out before the summer gets too late for the late teenagers and those in their early 20s. So give us a call, 586-247-3500, or visit our website at thegentlendentist.com. We are located in Shelby Township, Michigan. And how do we do? You all right?
Yeah, it's good.
Good? Okay, we're all done. Okay, thank you.